Good day, class. So, today we are going to talk about drugs that are used for neurologic disorders, such as those patients who are suffering from Parkinsonism or Parkinson's disease and Alzheimer's disease. So, we'll go ahead and talk about Parkinson's disease. So, with Parkinson's disease, as you can see here, it's a chronic progressive neurological disorder with rhythmic tremors as its initial manifestation. These tremors lead to rigidity and weakness, which interfere with the ability to maintain posture. As you can see it here in this illustration, the posture of a patient who has Parkinson's disease appears stooped, and they are experiencing involuntary tremors in their body while they're at rest. If you are familiar with the coach of Manny Pacquiao, Freddie Roach, he has this condition. And if you're familiar with Michael J. Fox, the actor for Back to the Future, if ever you have watched that wonderful film, he also has this disease. And they are experiencing these involuntary tremors. Other manifestation include bradykinesia, which is extremely slow movements, shuffling gait. So they take tiny steps while walking. That's how shuffling gait is. Drooling and slow slurred speech. So cranial nerve affectations can lead to a mask-like expression. That's why patients who have this condition, their face may appear mask-like. When we say mask-like, they're like a robot who has or who shows no facial emotions at all. And it is important to note that Parkinson's disease does not affect the higher levels of the cerebral cortex. So intelligence and other brain functions are the same level at the same level are still intact. So here, even though the patient has a CNS disorder, their level of thinking, their intelligence, and so on, it's still intact. There's only a problem with their motor skills. So the actual causes of Parkinson's disease, again, this is unknown. But the manifestations are directly related to the damaged neurons in the basal ganglia of the brain. So that's the part of the brain that is affected here in this disease. Take note, it's the basal ganglia of the brain. Neuronal damage is thought to be caused by, again, viral infections, head trauma, brain infections, atherosclerosis, and drug and environment exposures. Head trauma is usually associated for boxers who are suffering from this condition. Let's we have Freddie Roach, for example, who suffers from this. Muhammad Ali, when he was still alive during his elderly age, is one of the greatest boxers, heavyweight boxers of all time. He suffered from this disease. So, due to constant trauma to the head from that sport, can bring about Parkinson's disease. But if the exam asks you what the cause of Parkinson's disease is, the thing that you're going to answer is it is unknown, it is idiopathic. So as you can see here, this is a clear patient who is suffering from Parkinson's disease. Parkinsonism, it is referred to as Parkinson's disease-like extrapyramidal symptoms, which are associated to particular drugs such as antipsychotics or brain injuries adverse effects. And take note for um, antipsychotics, I've already mentioned this to you before, they can exhibit pseudo Parkinsonism since it will um, it will create or it will decrease rather the dopamine in the CNS. And take note, in Parkinson's disease, one of the theories here is there is a decrease in the dopamine, which is a neurotransmitter found in the CNS. So we give anti-Parkinsonism agents in order to control the signs and symptoms of the disease. So these are drugs used for the management of the signs and symptoms of Parkinson's disease or patients suffering from Parkinsonism, such as those who are experiencing the adverse effects of antipsychotics. There's no known treatment for Parkinson's disease since this is a progressive type of disease. And drug therapy, these anti-Parkinsonism agents, they're the only ones that are used to be or are used as primary treatment for Parkinson's. The goal of therapy is to restore the balance between decreasing dopamine levels, has an inhibitory effect on the neurons of the basal ganglia, and increasing cholinergic neurons, which has an excitatory effect on or in the CNS. So that's what happens um, in these drugs. Dopaminergic agents. These are drugs that increase the effects of dopamine at the receptor sites. Therapeutic action is that dopamine does not cross the blood brain barrier. So, other drugs with action similar to dopamine and those that increase its concentration in the substantia nigra, which is the area responsible for muscle tone, must be used. This is one way of restoring the balance between stimulatory and inhibitory effects of the neurotransmitters. So this is what these drugs are doing to the CNS. And levodopa, which is the precursor of dopamine, is the mainstay treatment for Parkinson's disease. It crosses the blood-brain barrier and it is converted into dopamine. That's why dopamine itself is not used for the treatment because it will not cross the blood brain barrier. The precursor, levodopa, is the one that can cross it. So, when combined with carbidopa, which is the enzyme decarboxylase, enzyme dopamine decarboxylase, it is inhibited from metabolizing levodopa, leading to a higher levels that can cross the blood-brain barrier. So carbidopa inhibits this specific enzyme that will cause the lysis or destruction of dopamine. That is what the drug is doing. Now, remember capables. These are groups of drugs that are being used to control the signs and symptoms of Parkinson's disease. C stands for cogentin and carbidopa. A stands for artane. P for parlodel. A akinaton. B Benadryl. Benadryl is primarily used as an antihistamine. It has an antihistamine effect, but later on it was discovered that it can also help treat the signs and symptoms of Parkinson's disease. Because doctors found out that people who had Parkinson's disease who are also suffering from allergies who took Benadryl saw a decrease in the signs and symptoms of Parkinson's disease. That's why it was also it they began using Benadryl as well. Levodopa, which is the mainstay drug for Parkinson's. We also have Eldepril and entacapone. And lastly, Simitril. Simitril is an antiviral. It's used to treat flu infections, viral infections, respiratory viral infections. And some patients also who had Parkinson's disease were suffering from a flu virus at the same time. When they gave them Simitril, they have observed that these patients' signs and symptoms of Parkinson's disease has also decreased. So indications, dopaminergics are indicated for the relief, of course, of idiopathic Parkinson's disease. Levodopa is the drug of choice and acts as a replacement therapy. And amantadine, that's the brand name for Simitril. It's an antiviral drug that increases the release of dopamine. Apomorphine directly binds with postsynaptic dopamine receptors as well. So apomorphine can also be given. Now, contraindications and cautions. Allergies, again, prevent certain hypersensitivity reactions if there are any. This is not also given to patients who have angle closure glaucoma. Glaucoma is a condition where the patient loses their peripheral vision. And these drugs, they can exacerbate the condition of close angle closure glaucoma. They can further blind the patient, perhaps. Lactation and pregnancy, because these drugs, they can cross the placenta and can enter the breast milk. So do not give these drugs to patients who are lactating and pregnant. And take note, Parkinson's disease is not common in women. It's more common in men. Suspicious skin lesions, because levodopa is associated with the development of skin cancer known as melanoma. So they need to identify that skin lesion first, whether it's melanoma or not. Any cardiovascular disease, cardiovascular disease, bronchial asthma, psych disorders. Because remember, our discussion during antipsychotics. Antipsychotics, they decrease the dopamine levels in the brain due to the increased levels. It will further increase the dopamine in the brain in patients who have psychoses and hallucinations or suffering from schizophrenia. The schizophrenia can be exacerbated by these drugs. So take note about this. Those who have hepatorenal diseases, this can interfere with the metabolism and excretion of the drug. And apomorphine can increase the risk for hypotension and prolonged QT interval. The QT interval, you will learn more about this once you're in your third year when you are going to study cardio. So hopefully you will be my instructor, or yes, you're going to be my instructor for cardio when you're already in your third years. Adverse effects. In the CNS, there's anxiety, nervousness, headache, malaise, fatigue, confusion, mental changes, blurred vision, twitching, and ataxia. You can just read on the rest for cardiovascular, respiratory, GI, GU, and the others. Take note of those things. You need to teach these adverse effects to the patient. Interactions. If you give these anti-Parkinson's drugs to people who are taking MAWIs, it will increase the risk of therapeutic effects and also increase the risk of hypertensive crisis. So patients who are taking MAWIs should be stopped from taking it 14 days before beginning dopaminergic treatment. And those who are taking vitamin B6 and phenytoin, tell them to not take them at the same time because these vitamin B6 and phenytoin will decrease levodopa efficacy. And certain over the counter vitamins like vitamin B complex, because B6 is present there. Take note of that as well. Implementation. Decrease the dose of the drug as ordered if therapy has been interrupted to prevent systemic dopaminergic effects, if indicated. Evaluate disease progress and signs and symptoms periodically for reference of disease progress and drug response. That's what we usually do for patients who have Parkinson's disease, since this is a progressive drug. Give drug with meals to alleviate GI irritation if present, because some of these drugs can irritate the GI mucosa or gastric mucosa. Monitor bowel function and institute bowel program if constipation is severe. So, if, for example, they are suffering from constipation, we advise the patient to eat food that is rich in fiber, such as fruits and vegetables. Have the patient void before taking the drug to decrease the risk for urinary retention. Monitor the lab test results. Again, the renal and liver function together with CBC to detect early signs of dysfunction. And provide comfort measures to help the patient tolerate drug effects. Provide safety measure, this repeated every now and then, and educate the client about this drug. in order to promote understanding and drug compliance. Now we go to anticholinergic agents. These are synthetic drugs which have been developed to achieve a greater affinity for cholinergic receptor sites in the CNS. And drugs that inhibit the effects of acetylcholine at receptor sites of substantia nigra and the corpus striatum. So, therapeutic action of the anticholinergic agents is that they return the balance to the basal ganglia and reduce the severity of rigidity, akinesia, and tremors. Peripheral anticholinergics reduce drooling and other secondary effects of Parkinsonism. Indications, they are used together with Parkinson's disease, either idiopathic, atherosclerotic, and post-encephalitic Parkinson's, or those who no longer respond to levodopa. These drugs are also given. Contraindications and cautions, those who are allergic to dopaminergics. And check for hypersensitivity reactions is present. Again, angle closure glaucoma if present. GI and G obstruction, if there are any, do not give this drug. And those who have prostatic hypertrophy, because these conditions will be exacerbated by these drugs. Myasthenia gravis, it's exacerbated by acetylcholine receptor sites blocking the effects of the drug. So do not give these drugs for patients who have myasthenia gravis, because take note, these are anticholinergics. It will exacerbate the signs and symptoms of myasthenia gravis. Those who have tachycardia, dysrhythmia, hyper or hypotension, because they block the parasympathetic system, which may cause a dominance in the sympathetic stimulatory activity. So take note of that if there are any of these signs present. Hepatic dysfunction, because of the increased risk again of hepatotoxicity. Lactation and pregnancy, again, these drugs can cross both the breast milk and the placenta. Adverse effects, read on the rest for the CNS. For the cardiovascular, EENT is the eyes, ears, nose, and throat. GI, so as you can see here, paralytic ileus. It will cause paralysis of the GI tract, leading to constipation. So watch out for that. Urinary hesitancy, urinary retention, flushing and reduced swelling. So these are some of the adverse effects with the anticholinergics. Interactions. So if you give anticholinergics to people who are taking tricyclic antidepressants and phenothiazine, such as this, there will be an increased risk for potentially fatal paralytic ileus and toxic psychoses. So avoid mixing the anticholinergics with TCAs and phenothiazines. Antipsychotics. They have a decreased antipsychotic therapeutic effectiveness because of central antagonism of the two agents. So do not again mix this with antipsychotics, or else the antipsychotic drugs will be useless for patients who have schizophrenia. Take note, for the implementation, we should administer the drug with caution for patients exposed in hot weather or environments like here during the summer season, because patients are at increased risk for heat prostration due to the decreased ability to sweat with anticholinergics. So they are at risk for heat stroke. So take note of that. Give drug with meals because they can irritate the GI. Monitor the bowel function. Since there's constipation, again, tell the patient to increase fiber intake. Same thing, have the patient void before taking the drugs. Monitor lab test results again for renal and liver. Provide comfort measures, provide safety measures, educate the patient again. And evaluate disease progress and signs and symptoms periodically for reference of disease progress and drug response. The only one that you're going to take note here is this first one regarding hot weather or environments. So take note, we need to teach patients to be in a cool place while taking the drug. Now we go to Alzheimer's disease. Alzheimer's disease is a progressive and irreversible degenerative fatal disease and is the most common form of dementia among older patients. So, with this, take note, if Parkinson's disease is more common in males, Alzheimer's disease is more common in females. But that doesn't mean that some male patients won't suffer from this. My grandfather suffered from this Alzheimer's disease. He has passed away 3 years ago from this. And dementia is a brain disorder that seriously affects a person's ability to carry out daily activities. It usually begins at after age 60, and the risk goes up as you get older. Risk is also higher if a family member has the disease. So hopefully I won't be having this, but time won't tell. Time will tell. Clinical manifestations of Alzheimer's. Memory impairment. So they have impaired ability to learn new information or to recall previously learned information. So for patients who have this, they won't even recall what has happened yesterday. So that's for Alzheimer's disease. And they have trouble recalling information about the past. And take note, patients who have Alzheimer's disease, I've seen several old people suffering from this. They, in the experience of having dementia, they thought they are in a time or place that they were in the past. Let's say, for example, my best friend's grandmother who suffered from Alzheimer's disease, when we visited her at their ancestral home, she thought that she was at, or she was currently at the faculty room at one of the universities here in Dagupan. And she's disoriented because her mind was in a time and place in her past. And what happened there was she thought she was talking to her coworkers. And her grandson, me, and my brother who visited her thought we were her coworkers. She cannot even recall who her grandson was at that time. And her mind at that time was oriented to a time when her sons were still in their, what do you call this, 20s, when they were still bachelors, when they weren't married yet. This is what Alzheimer's disease does to people. It somehow um, lets their mind time travel to a thing of their past. That's why the present the present time is not there for them. It's not they're not oriented with the present time. They're confused. So aside from that, they have impairment in abstract thinking, judgment, and impulse control. They easily are irritated. They easily get mad. They have impairment in language ability as well, such as naming objects. In some instances, the individual may not speak at all. They may have aphasia. And their personality changes are common with patients who have Alzheimer's disease. There's also impaired ability to perform motor activities despite intact motor neurons, such as apraxia. And they are disoriented. This is what I was telling you earlier. They are disoriented regarding about the current place, time, or names of persons they are close with. My grandfather cannot even recall who I am when I visited him before he died. He said, "Who are you?" And when there was a wedding that was going on, he was unaware of what was happening since he was already suffering from this disease. So even his own sons and daughters, my uncles and aunts, my mother, he no longer recognizes them because of having this or having dementia. They may wander out because of disorientation. Patient with dementia may wander from one place to another. This happened to when I was a kid. We had a neighbor who was suffering from this. He was a male, an old male. He was a relative as well, and he wandered out of their home and found him already at or in La Union. That's how far he went when he wandered out of their home. So they should be well guarded, patients who are suffering from this. And delusions are common, most especially delusions of persecution, especially if you are going to insert an IV, going to inject them, and so on. They feel that they are being tortured. Nursing interventions, we need to orient them at all times. Orient the client to reality and surroundings. You tell them if your grandparent cannot recall who you are, tell them, I am your granddaughter or your grandson. Allow the client to have familiar objects around him or her, or use other items such as a clock, a calendar, or daily schedule to assist in maintaining reality orientation. And make sure the furniture at their house still remains in the same position as well. You should not rearrange it because they are already disoriented. They will be further disoriented if you change the positioning of the furniture. Encourage caregivers about patient reorientation. Teach prospective caregivers how to orient client to time, person, place, and circumstances as required. These caregivers will be responsible for client safety after discharge from the hospital. So, even circumstances, we need to tell them these things. Like when we were about to attend the wedding of my sister, my grandfather was asking, where are we going? Saan tayo pupunta? Sabi niya ganun. We were always telling him, my sister, your granddaughter is already getting married. So we need to reorient. We need to have patience with these kinds of patients. So we enforce positive feedback if they've done something good in the day. Give feedback when thinking and behavior are appropriate or when client verbalizes that certain ideas expressed are not based in reality. You need always to present reality. Positive feedback increases self esteem and enhances desire to repeat appropriate behavior. And when we are giving instructions to patients who have Alzheimer's, we explain them simply. Remember KISS, KISS, keep it short and simple for patients who have Alzheimer's. Keep it short and simple. If you give complicated instructions, they won't follow them. Use simple explanations and face to face interactions when communicating with the client. And remember not to shout into the client's ear. You need to speak slowly in a face to face position is most effective when communicating with an elderly individual who is already experiencing a hearing loss. If he can't hear you, move closer. And discourage suspiciousness of others. Express reasonable doubt if the client relays suspicious beliefs in response to delusional thinking. Discuss with the client the potential personal negative effect of continued suspiciousness of others. You need to advise that to the client that the person that he is suspicious with or she is suspicious with is doing nothing wrong. This was also happening with my grandfather when he was still alive. He was always suspicious of one of my uncles, and he was even combative. He was fighting with my uncle, and they need to calm him down. Avoid cultivation of false ideas. Do not permit rumination or thinking of false ideas. When this begins, talk to the client about real people and real events. Since they can have delusions, most especially delusions of persecution. Observe clients closely. Close observation of clients' behavior is indicated if delusional thinking reveals an intention for violence, and client safety is a nursing priority, especially if they are wandering about. Now, these are the drugs that are used to treat Alzheimer's disease. We have Tacrin or Cognix, Galantamine, Razidin, Rivastigmine, Exelon, and Donepezil, Aricept. And they slow the progress of Alzheimer's disease by causing accumulation of acetylcholine at the receptor sites in the brain. So that's what they do, these drugs. Dacrin, galantamine, rivastigmine, and donepezil. Side effects. Most common side effects of rivastigmine and galantamine are loss of appetite, nausea, vomiting, and diarrhea. Just take note of the other side effects mentioned here. They are self-explanatory on what they are. And take note, they can elevate the blood pressure. So you need to monitor the blood pressure of the patient. And since there is constipation, again, advise the patient to take fiber-rich foods. Okay, so that's it for our topic under Parkinsonism and anti-Alzheimer's drugs. So if you have any questions about our lecture for today, just please send me a message. I'd be more than glad to help you out with these questions. Again, thank you for listening and goodbye. Have a great day, everyone.